Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019. The Nurse Staffing Bill aims to provide standard registered nurse-to-patient ratio guidelines. It was enacted in response to a report indicating that optimal patient care is directly related to the number of nurses present in a hospital ward. This bill provides a remedy against the unsafe ratio of registered nurses to clients. A patient's understanding in numbers should be put into consideration when allocating nurses. Guidelines for the use of unlicensed personnel in offering care are also provided for in this bill. Furthermore, it prohibits nurses averaging to equal the number of patients and reduces the number of supporting staff following ratios in nurse staffing. This is a federal bill number H.R. 2581 of Congress. The bill's title is Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019. It was introduced to the House of Representatives in August 2019. It was read twice before being referred to the Committee on Finance for further consultations on the bill's cost implications. The bill addresses the policymakers and nurse practitioners. It calls for amendments in the Social Security Act to provide for safe nursing staffing. The progress of the bill is still in the committee stage. The bill was sponsored by Senator Schakowsky, who is a legislator in the House of Representatives. Ms. Schakowsky also received the support of other senators during the introduction of the bill to the House. The National Nurses United organization co-sponsored the bill that agitates for the primary care providers' improved staffing. Moreover, the bill offers recommendations for forming a committee in the hospital composed of mostly registered nurses who will be responsible for nursing staffing. It provides for the minimum number of reported nurses ratios to work in the hospital's various acute settings. The nurse managers and leaders are exempted from the nursing staff ratio calculations. The bill indicated the replacement of the registered nurse's clinical judgment with any form of technology in inpatient care, including video monitors. This bill was selected as a topic of study due to the grave implications of the mismatch in nurse staffing in the United States. The ratio of nurses to a patient in the United States is at its all-time low. This is due to the growing number of the aged in the population and cost-cutting initiatives by hospitals. Besides, the number of individuals seeking treatment following substance and opioid abuse has considerably increased. The rising number of retiring nurses further complicates these factors. The void left by the nurses leaving services in the rural areas is hard to fill due to the low number of newer nurses interested in working in these locations. Additionally, the low ratio of nurses to patients impairs holistic around-the-clock care by nurses. A study found that many nurses felt that they did not have the adequate time required to offer individualized psychological and physical care to patients. Furthermore, these nurses thought that they did not have time to give health education to patients and their families due to an increased workload. Moreover, patient safety is greatly hindered due to a high incidence of nursing errors following a high patient-to-nurse ratio. Adequate nurse staffing is linked with reduced patient readmissions in hospitals, improved patient satisfaction, and prevented nurse burnout at work. These challenges in healthcare necessitated changes in laws to address the issue of nursing staffing.